outnumber the number, and that's still not much has changed. But we can see that as far as the months are concerned, March is recorded. We are in the middle of March, and we have a relatively fewer number of cases. And we hope that the number is also a reflection of Ghana's cases, especially where we are receiving cases from. And we hope that will continue and reduce the number of imports that we are getting into the country. Next slide. The positivity rate at the airport too has come down and also peaked in January when we had our own number of influx of coming, especially with the new variant coming in. It has also come down significantly. I think one of the most important steps that have been taken recently is the opening of schools in January. And that also came with the issue of managing the protocols at the schools to ensure that the school doesn't become the breeding ground for COVID. So far, 316 schools have ever reported a case. Total number of cases recorded in the school is 1,920. Northeast region is the only region that has not reported any case in any school. One mortality was recorded among cases in the schools, and the active cases of the school stands at 220. Remember last week it was about 570 there, but it's actually dropped down, which means that we are not getting more positive than those who are recovering. And the next shows you that Ahafo has made reports. 7 schools have reported cases. 30 of them, 26 have recovered. We have 4 active cases. Ashanti had cases in 34 schools. They are currently having 3 active cases. Bono has from 38 schools with 245 cases. They have 11 active cases. Bono East from 22 schools. They had 97 cases. All of them, only 2 are active, which means 95 are recovered. Central is also 16 schools with 19 active cases so far. Eastern, 27 schools reporting 328 cases, but they currently have 3 active cases. Greater Accra had 47 schools reporting cases, and currently they have 49 active cases. Northeast, no case. Northern region, 4 schools, and they have 2 active cases so far. The same goes for OT with 10 schools. OT has 10 schools with 18 active cases currently. Savannah, only 1 school reported a case. They've all recovered. So it's 9 cases in 1 school, so they currently don't have any active case. Upper East, from 32 schools, got 52 cases. They are currently recording 2 active cases. Upper West, no active case. Volta region has recent cases in whole township, so they have 100 active cases after reporting the highest number of cases of 467. Western region has from 34 schools recorded 183 cases. Currently have 5 active cases. So in total, Western North, 8 schools, 18 cases. They have 2 active cases. In total, 220 active cases is what we have. 316 schools have so far been infected, and about 1,700 students have recorded it. Okay, now we'll go to our vaccine update. This is as at the 21st March, 11:30 a.m. As you are aware, we started our vaccination on the 2nd of March, 2021, using so far AstraZeneca vaccine. As at 21st March, that's yesterday, we have so far recorded 468,581 persons have been vaccinated. And I must add that there are portions of areas where entries have not done, especially in Accra and parts of Ashanti region, especially some sections where they are still keying the data. Greater Accra has the highest number of persons vaccinated, about 260,954. But if you look at the next chart, you can see that cumulatively the number of vaccinated has gone up, even though the chart has not, the gradient has not been as high towards the end, because the numbers of people we are searching for have significantly dwindled, and we are just mopping up. So this just shows the total number of cases that is being done, and the 8th of March probably was the highest number of cases that was ever vaccinated in the country. As at 20th, we had about 590 vaccination done in the 3 zones that we are currently working in. So if you get a general breakdown, you see Ashanti has done 195,449 people have been vaccinated, first dose. Central, 12,178. Greater Accra, 260,954, bringing the total to the 468,581 people who have been given their first dose vaccination with AstraZeneca. The chart shows you the 43 districts that we are working in, and look at the sex ratio, male, female, to see where we are. I think there's a more okay, when we get to the final one, it's just almost a par between males and females. We also, the number of vaccinations in absolute numbers. You can see the highest in Kumasi Metro, followed by Accra Metro. But Accra has a spread, but so they still have that. So that tells you how the vaccination has gone. The next slide. The previous slide is just showing that the target versus what was achieved. There are areas we have exceeded, there are areas we are just under, but some of them were. So if you look at the next slide, you can see Greater Accra has 56%, 42% Ashanti, and 2% for Central Region. We're doing only two districts in Central Region. When we started the vaccination, we had a special segmentation. The top priority was let's mop up the hotspots where we have a lot of breeding grounds, Greater Accra, Ashanti, and part of Central Region, which is actually a contiguous part of Greater Accra. And also in that, we needed to look at certain category of people, health workers, adults over 80, 60 years of age, because of the associated mortality in that group. And then also the general population. We also had persons with disability who have underlying conditions like hypertension, because these were the ones who are actually don't do very well with the disease. And so we went out to target them. We also looked at the people who are actually at the forefront, health workers, security people who have to meet people all the time, to also vaccinate them. And of course, keep the states running, so making sure the legislature, executive, and judiciary is also somehow protected. The front line of that group, front line. So if you look at that chart, you can see that the highest group is the adults, adults over 60, and we've done about 102,186, followed by the general population of about 93,502. I would say the general population, a lot of them is a bit of misclassification if you are not able to assign them appropriately to whether it's security, whether it's a media person. If it's a media person, is a media person with hypertension or whatever. These are areas on the field that create a challenge, and so they are aligned as general population. Then the third is the health workers, about 73,000. Persons with known underlying conditions is about 64,870. So by and large, essential service workers, about 59,000 of them. So by and large, the segmentation has been achieved. If you look at the people who greatly benefited from the first phase of vaccination that we are doing. Next slide. So the sex ratio is 48% of all those vaccinated are males, with 52 being females. We also, as part of our information gathering to see how to improve acceptance of vaccination. We looked at where they are getting their information from. And persistently, we have seen that a significant number of them are getting their information on vaccination on television, followed by radio, and then third is health workers. We have other social media comes in quite strongly, and community information is also out there, and then the mobile vans that are going around educating people have been cited as one of the areas that they also get to know about the vaccination. Let me take my attention to the AstraZeneca issue that was dominating the airwaves last week. Some countries in the European Union temporarily suspended the use of the AstraZeneca COVID-19 vaccine as a precautionary measure based on reports of a rare blood coagulation disorders in persons who had received the vaccine. So other countries in the EU, having considered the same information, continued using the vaccine in their immunization program. So what it means is that not every EU country gave the temporary suspension. As we continue to say, vaccination against the COVID-19 will not reduce illness or death from other causes. So doesn't mean that because you have had vaccination, if you have any thromboembolic or a clotting disorder, it will not occur. And so we wanted to make sure that is clear. And these occur very frequently. So whatever happens to you, we have a way of doing a causality analysis to see whatever happened to you, is it because of the vaccine or not, before we look at that. We have done some 3 that I can share with you. So globally, venous blood clotting event is the 3rd most common cardiovascular disease in the world. In mass vaccination campaigns, it's routine for countries to signal potential adverse events following immunization. And that's why we have a very strict process of following up people with any event that causes, so that we learn whatever is happening and make sure that it is not associated with the vaccine. It also does not necessarily mean that the events are linked to the vaccination itself, but it's a good practice to investigate every reported case after vaccination. So what happened there is right. It also shows that the surveillance system works and that effective controls are in place. Otherwise, sometimes things may be happening without knowing. And so as long as people are reporting, so far about 1,500 or so plus people have reported some adverse events that we are following. So the European Medicines Agency has reviewed the cases I was reported, and that led to the suspension, and indicated that the AstraZeneca vaccine is safe. The Ghana FDA has also issued a press statement that no blood clotting events have been detected in its robust adverse event monitoring system, which we do with us, the Ghana Health Service. Finally, WHO, the European Medicines Agency, and Ghana FDA, and many other regulatory authorities around the world indicate that AstraZeneca continues to be safe and recommend its continuous use in its fight against pandemic. And so that is what we are continuing to do. So just to bring the information that is safe and that everybody should just participate in the vaccination and not worry about some of those events that are happening. The most common complaint we've had so far since vaccination started, about 1,575 who are reported, are headaches, fever, pain at the general injection site, and general body aches. These are the commonest complaints that we've had from the many 1,575 people that we have investigated. So far, I think they've done about 3 causality assessments, and that is, we look and say, was this, and we do that because when the event is severe, 2 are unrelated. The 3rd one was the fact that because it was a sickler and had induced a sickle cell crisis. And so, but the person is fine and is back home. I'm sure we are all eager to see when is the next vaccine coming. But our next phase of work is to vaccinate all other health workers across the country because they are frontline wherever they are. And that will give us about 90,000 health workers, minus those who are already vaccinated, will be vaccinated, both public and private, starting from Monday. The trainings have taken place. We collected their information, their names, their location, and each district will have 2 sites for vaccination. And we are hoping that within a week or 2 weeks, all health workers would have been covered across the country. So far, Ghana needs about 42 million doses. That's if you are using only 2-dose vials for all to vaccinate the 20 million people we have targeted to do by October. This includes the wastage, anticipated wastage, and that's why it's 42 million. So far, we have a certain quantity from the COVAX platform, which is about 12 million plus for about 6 million people, covering 20% of the population. We are also having about 17 million plus requested from the African Medicines platform that we hope to arrive in. There are also the private sector of Ghana is also partnered with the government to bring in additional quantity through the COVAX facility to make up the Bamba. We are also involved in bilateral discussions with other vaccine manufacturers to be able to fill up this number. So far, we have received the 600,000, additional 50,000 plus, and MTN, as part of his corporate social responsibility, is supporting Africa with vaccines, and we are expecting that the next day or two, we will receive about 160,000 doses for as Ghana, and this will be part of the quantity we are expecting to add. We are expecting that in the next 2 weeks, we will get some inflows again from these areas where we are expecting them to come. What we don't know is that we don't have very definite timeline, but we know that within the period of where people are supposed to receive their second doses, we have received enough vaccines to cover more people and give those who are due for the second dose. And let me remind you that the second dose is 8 to 12 weeks from the date of vaccination. We are tentatively using the 8 weeks as the next vaccination, but there's also the buffer of 4 more weeks. And the issue is that the longer the separation, the more effective the vaccine is. And so we'll follow up with a timetable, the data has been given, and continue with the vaccination. Finally, Honorable Minister, I want to talk about the alleged theft. I think we issued a statement yesterday that noting the fact that the security service have arrested people who purportedly have been taking vaccines and selling to the private sector. We are working with them. We have also initiated some administrative procedure for the various leadership in those centers to give us a report. Vaccine accountability process has been intensified to ensure that we are able to uncover any other ones that we don't know about. I also want to remind people that this current vaccines is under emergency use authorization. So no private person is allowed to handle vaccines. So anybody walks to you that I have vaccines and is not a Ghana Health Service worker designated to do, that is something wrong. It is not, it's under emergency use authorization. So please help us to identify anybody who comes in with a vaccine I want to give it to you. We are working with the security agencies to unravel. If they are found culpable, the necessary actions will be taken as a service. As far as also, I'm sure the rest of the legal matter, I will not get into that. So, Honorable Minister, this is where we are. Thank you very much.
Thank you, Dr. Cassius. Stay with me. We'll take a few questions and then we will wrap up. I saw a number of questions, or one for you online. That we do know that we've also got Sputnik V in the Ghanaian jurisdiction, but a lot of commentary suggests that we are using Astra. So there's a question from one person named Jimmy. When will the vaccination using Sputnik V are there any other questions of Ghana Health Service on vaccination and COVID? So I think that'll be the only one as we have it. Then I'll take one final one that was okay.
Can I answer now?
Yeah, go ahead.
Yeah. Yes, I talked about some bilateral arrangements on other vaccines, and we know that within the next week or two, we will get some doses of Sputnik V, and then we'll also start as part of the Group 2 vaccination. We'll use that, and we are waiting for a confirmation of the exact day that they will come, and then we will take it on. So yes, we've registered Sputnik V. We have arrangement that some are coming in. And I will brief you.
No, thank you. While you resume your seat, let me deal with just one other question I noted. The question was whether or not there are any countries that have introduced or are considering introduction of revenue measures post-COVID in other parts of the world. So, for example, the UK is hiking corporate tax, I understand, to about 25% to support their response program. British Finance Minister Rishi Sunak announced on Wednesday that the UK corporation tax will increase to 25% in April 2023 as the government looks to restore public finances in the aftermath of the COVID-19 pandemic. I think in Indonesia, they've done a 10% VAT on sales by technology firms. And then in Argentina, they've passed a new tax on the wealthiest people to pay for medical supplies and relief measures. In Saudi Arabia, they are considering tripling their value-added tax as part of austerity measures following the COVID response program. I think in the US, they are also considering some of the major hikes since 1993. So we are not alone in this situation. Colleagues, maybe I'll just take that in chi. I'm saying, no, be bisase, enti Ghana and Kwana, yɛhwɛ kwan a yɛbɛtumi ɛnyɛ sika de ako atia saa yare a na sɛ yɛko awie no na yɛko akɔ yɛ nim no yɛsika sɛm a ɛhwehwan no yɛbɛtumi ayɛ no yie. Wohwɛ UK a ɔmo sɛ ɔmo de ɔmo corporate tax ɛkɔ bɛyɛ 25%. Indonesia ɔmo sɛ ɔmo de 10% value added tax on technology firms ɛɛba. Argentina ɔmo yɛ new tax ɛde atua for medical supplies ɛne other relief measures are omoye. Saudi Arabia omo dream who say omo bebo omo value added tax no home prensa. America for yes your mampany Biden on also heard the first major tax measure since 1993. Taxes are ye peja mudia imu kakra since 1993. And after almost pass it by 1.9 trillion at the support in Yama Ekosono. Inti enye yanko na baby we are sina biduno. Ubia esane na bosu kakra ni nyina yetumide akwanim. We're grateful to you. Wish you guys all the best. Maybe during the week we'll re-engage for a midweek brief. Thank you so much.